Yeah? If I brought the legs up below now, if I brought the legs up, rest his knee on my hips, and if I just literally just find PSIS, find the L5, there we go. Oh, he's a bit stiff. Okay, so L5, S1 for movement. Okay, when I can go to one above. Yeah, that's 4, 5. 4, 5 is better. 3, 4. 4, 3, 4 is a bit stiff. Okay, so I'm trying to open 4, 3, 4, yeah? Go to the next one. 2, 3, that's a bit stiff as well. They're all stiff. Yeah? They're all a bit stiff. It's your age. But then you can ask yourself a question, you know, what is he presented with? What's the symptoms? Yeah, because we're all a bit stiff in some way or another. Yeah, but it's not a bad thing. Yeah, because you want some stiffness in that lumbar spine because there's not much rotation anyway. Okay, it's better to have a bit of flexion and extension because that's what you need for the cardinal plane. So if you feel, you know, there's a joint that needs some motion, we're going to just encourage some MET mobilization manipulation for that. So let's say that this side, because it is a rotation, so there is a rotation on the left, yeah, even though it might be fixed on the right, I said. Yeah, but we say for now that the left side is fixed. Okay, that's where the high side is. So high side up, just keep it simple. I mean, once you learn the simple bits, then you can start adding to that. Okay, yeah, you know, it's about trying to do this a few times, lots of times. Yeah, then once you feel you're ready for the next stage, then start to learn the next stage. That's the best way, rather than trying to confuse you, which I'll probably have anyway. That's fast and we'll go with it. Too slow. Yeah. Right. The standard position. When you read books on setup, they might say the foot position, yeah, towards the foot for L5. Some say the foot in the knee for L5. I'm going to show you the way I do it. So from there, I tend to put the foot in the crease of the knee. And that's where I keep it. The lower leg is a little bit flexed. If I'm saying the joint is extended for now, yeah, I want to encourage opening. So that's the position to start with. I've never tried this couch, I might go into my one in a minute. Okay, so from there, when the workman always blames his tools, isn't he? Yeah. Okay. First step, okay. Right, so what I'm going to do is, hand there to counterbalance, I'm going to feel, so let's say I want to articulate 5, so I'm going to feel 4, and I'm going to pull him towards me. I'm doing it. Oh, you're stuck there, aren't you? Yeah, so I'm going to pull him until I feel a rotation there.
So do you go to where, so say for it's L4, you rotate till you get to L4?
L3.
You go L3.
Yeah, so if I want to manipulate L4, I'll feel L3. When I feel it's bind, I'll stop.
Right, you don't go past it?
No, I don't go past it because I lock past it. I want to lock to it, not on it. Well, not past it, yeah? So towards it rather than past it.
Yeah.
So that's the position we're in. Hand on the knee. Yeah. Hand on the, you know, it's been one of those days, okay? So what we're going to do, mate, oh, God, everyone wants to help with it. Yeah, no, just stay like that. Don't do anything. All right, just rest. So now, what we're going to do now is feel that area, but there's not much I can do because he's away from me. To get the technique, and sometimes you'll get it to mobilise just by rotating him. So you can use the forearm, okay, and it feels like you're going to fall off a couch. Okay. So I'm going to come into this position here. You okay there?
Yeah.
Okay, so I was just testing to see if it's going to play. Can you see already, by not manipulating, I manipulated. Yeah? Alright, so to be honest, for in terms of safety, that would be perfect, wouldn't it? Because you're not forcing anything, or not thrusting anything. I'm not going to cause a problem. Yeah? And to be honest, I've done it now. Yeah, without doing it. Yeah? I actually did it without doing it. Yeah? Okay, and it went where my thumb was, where I was trying to set him up. I was hoping, I wonder if it was going to go there. Yeah? Okay, but anyway, from this position, you're right, so Rich, yeah. I'm going to do an MET now, so I'm just going to change an angle there. No, don't do anything, I'm doing it. Yeah, so from there, his knee, my hand. You and knee, push up into my hand. So he's causing the pelvis to rotate back. Think about, let's say I want to just manipulate this joint in here. Yeah, so I'm going to get him to pull back, so he's going to pull that way for 10 seconds, which he's done. Yeah, let's say, and relax. Now I'm going to encourage a bit more movement using his knee. And my thumb is feeling, this hand is doing. Okay, so this is feeling, this is doing. So I'm just going to literally articulate that joint. So I'm going to mobilise that level there. This is not really the position I'd be in to manipulate because I'd drop in and I'd come in low and I'd come in and I'd thrust through. Yeah, then this is just a MET to start with. So I'll MET into a mobilisation, you see that? And if it happens to click, then give yourself a pat on the back if it's where the thumb is. If it's up here, you've missed it. Yeah, okay, alright, so that's a little articulation. Can you just rotate the other side? As in